People usually address the physical changes that happen after a stroke, but mental health issues are often overlooked. Today, we're going to talk about why mental health changes happen after stroke, the two most common types of changes, and some exercises that can help you deal with them. Before we start, make sure that you're subscribed to the channel to help us reach more survivors around the globe. Let's get into it. Why does mental health change? Mental health changes after a stroke primarily for two different reasons. One, it is a life-altering traumatic experience. No one wants to have a stroke, and dealing with both the events of being in the acute care and then the rehab hospitals can be completely overwhelming. Transitioning to home is another aspect that causes a ton of stress. And then adjusting to your new normal at home is an added anxiety. And of course, number two, stroke changes the brain. If an area of the brain that regulates emotional and mental health is impacted, you'll likely see those changes as well. Anxiety and depression. While there are many types of mental health issues that can come up after a stroke, like grief, loss, frustration, and anger, anxiety and depression occur in around 25 to 30% of stroke survivors respectively. And the symptoms of both anxiety and depression can happen early on in the recovery process, months later, or even show up again and again over the years. The most common worries that I hear about with anxiety are feeling afraid of having another stroke, anxiety about lingering effects of the stroke, and more generally, concerns about money and the ability to care for one's family. Sometimes anxiety can spiral into panic attacks, and although I haven't had a stroke, I do have a history of panic disorder, and I can say from personal experience that they're one of the scariest things that I've ever experienced in my life. Panic attacks make you feel like you can't breathe or that you're having a heart attack. I even went to the emergency room once thinking that I was dying, when in reality, I was having a panic attack. So firstly, if you experience anxiety or panic attacks, there is no shame. We're all doing our best to make our way through the world, and after a stroke, everything has been completely turned upside down. Now, depression or low mood can make you feel apathetic, like you just don't care about anything, or perhaps make you feel like you just can't cope with the changes that you're experiencing. You may also find that things that used to bring you joy have absolutely no effect anymore. And feeling this way is understandable, especially if you're grieving the person that you were before your stroke. The good news is that while these changes are pretty common, there are things that we can do about them. What to do about it? Anytime someone is experiencing a new mental health issue or crisis, the first things I recommend are 1, reach out for professional help from a mental health therapist, and 2, talk with your healthcare provider about medications that may be helpful. And of course, if you think that you're having a panic attack but you're not sure, or if you are feeling suicidal, it's always better to get checked out. Call your emergency number immediately. If you've already reached out to a mental health care professional and talked with your doctor, I also want to give you some practical tips on what you can do at home. The first technique is called 4-7-8 breathing. When we're feeling super stressed or anxious, taking a moment to utilize the 4-7-8 breathing technique can be really helpful. When we are anxious, our body is in fight or flight mode. And while this used to be helpful for our ancestors when they were being chased by like a tiger, thoughts can trigger this response now, even when it's not helpful. Using this technique can help to regulate that fight or flight response and provide a calming effect. So how do we do it? Well, we breathe in for 4 seconds, hold breath for 7, and then breathe out for 8. Let's try a few together, shall we? So what we're going to do is start by taking a deep breath in through your nose. I'm just going to count 1, 2, 3, 4. Hold it in for 7. 1, 2, 3, 4, 5, 6, 7, and slowly blow out for 1, 2, 3, 4, 5, 6, 7, 8. That is the 4-7-8 breathing technique. Let's try that one more time. I'll count again and you can try it. So we're gonna breathe in through your nose for 4. 1, 2, 3, 4, and hold. 2, 3, 4, 5, 6, 7, slowly release. 4, 1, 2, 3, 4, 5, 6, 7, 8. Nice job. Using a technique like this can be really helpful, but it takes some practice to be able to apply it in the midst of feeling anxious. The second technique is visualization. Using visualization techniques can be helpful for both anxiety and depression. While there are many ways to practice it, my favorite is picturing your happy place. Maybe you take a moment to visualize the most beautiful place that you've ever been, or you could literally picture yourself in a room full of puppies. Imagine how happy and calm that this place makes you, and stay there for a while. You'll be surprised at how this can alter your mood. Let's practice for a minute. Close your eyes and think about your happy place. Is it somewhere that you went as a child? Is it being with your family? Is it a lovely hike that you went on in the past? Picture it now and think about how it makes you feel. Does this place bring you joy and peace? Does it feel comforting to be here? Sink even further into that happy place and enjoy yourself. Enjoy that new peace. And when you're ready, go ahead and slowly open your eyes. So using this visualization technique is something that you can build into your daily routine to help bring a sense of calmness into your life. And lastly, cognitive behavioral therapy. Now, this is a technique that's typically used by therapists with their patients, but I want to give you a general understanding of how this technique works. Essentially, cognitive behavioral therapy, or CBT, helps someone grasp the connections between the way that we think, the way that we feel, and then our behavior. Each aspect has an impact on the other, and they're linked. The way that we think can impact the way that we feel, which then can impact the way that we behave. And the way that we feel impacts our behavior, which can impact our thought process. So let's take a look at a simple example of how you could apply CBT principles. So a thought may arise like, I am so anxious that I will have another stroke. And that thought can turn into anxious and fearful emotions, which may then lead you to change your behaviors. Maybe you stop going out as much, or you begin limiting social interactions. And while this is a valid concern, living in that state of fear and anxiety won't help you prevent a second stroke. Instead, this is where you might use something called cognitive reframing, or changing the way that you think about something. For example, in this particular scenario, you might say, okay, this is a real concern, but what can I do to potentially prevent a second stroke? And you might follow up by saying, well, I could see a doctor to discuss my risk factors. I can make lifestyle changes to ensure I'm doing everything within my control to change that outcome. And I can make sure that I'm still seeing friends and family, because I know that social isolation can make my stress worse, which is a risk factor for stroke. By changing the way that you think, you alter both your emotions and your behavior. And if you experience anxiety, take a second to reflect on what you're anxious about. Are there ways that you can change your thought process around that issue for a potentially better outcome? Dealing with mental illness is challenging at any point in our lives, but especially after something as traumatic as having a stroke. Remember to reach out for professional help. Talk with your doctor about medications. Contact emergency services if you are in crisis, and use some of these techniques to try to help you better deal with some of these mental health changes.